So when I started my medical coding career in ICD-10-CM, I had very difficult situation where I am unable to understand difference between aftercare and follow-up. If you are also having the same problem now, please watch this video until the end. So in this video, first we will learn about difference between follow-up and aftercare, and also ICD-10-CM guidelines related to follow-up and aftercare, as well as few example scenarios related to these two topics. So today our topic is aftercare versus follow-up in ICD-10-CM. Okay, so as we discussed, most coders mix this up. So basically they don't know the difference between aftercare and follow-up. So combinedly, let us fix it. Okay, so it looks like very simple, but because of coding change, it will create frequent denials during audits. Okay, first we will see aftercare. So what is aftercare? Aftercare means treatment is still happening. What is aftercare? So treatment is still happening to the patient or with the patient. Okay, so when do we use G codes? The condition is not fully healed. The patient still needs recovery care. Healing, rehab or ongoing management is required. And even if the main condition is treated, the body is still recovering from the main condition. So that time we need to code it as aftercare. So next we will see few common scenarios related to aftercare. So what are the common scenarios? Wound care after surgery. Okay, and physical therapy after fracture, cash checks or suture removal. Okay, so chemo or radiation visits after cancer diagnosis. Okay, so these are the common scenarios for aftercare. So that time you need to use aftercare G codes for all these scenarios. Mostly you need to check these things. Okay, the condition is not fully healed. The patient still needs recovery care. Healing, rehab or ongoing management is required, and even if the main condition is treated, the body is still recovering. Okay, no need to worry. We will see few example scenarios also. Okay, so what is the coding rule for us? Do not code the original acute condition again. So you need to code the aftercare codes, which is G code. Okay, or aftercare G code. Whenever in the documentation you see all these example scenarios like wound care after surgery, physical therapy after care, after fracture, cash checks or suture removal, chemo or radiation after cancer diagnosis, you will not code this cancer. So you need to code G code for aftercare. So that is the most important thing you need to remember. So just think like that. Active recovery phase is the aftercare. And also, if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also, anyone looking for same-day surgery training, IPDRG training, SCC training and CCS certification training, please send WhatsApp message to 707-526-3939. So now we will see follow-up. Okay, so what is follow-up? So for everything is done, just checking. So patient had undergone like permanent treatment for his condition or her condition. So everything is done basically. So here now patient came in for just checking whether the previously performed procedure is underwent well or not. Okay, so when do you code follow-up codes? So the condition is fully resolved. So that time you can code follow-up. No treatment is being provided. You can code follow-up codes. Okay, mostly the follow-up visit is to confirm whether there is any recurrence or any complication related to previous surgery. Okay, in ICD-10-CM we have two codes for follow-up. One is G08, follow-up after completed cancer treatment. Next G09, follow-up after completed non-cancer treatment. Okay, if in follow-up also you need to check two codes. So basically you need to code based on the patient's condition. Okay. If it is for follow-up after completed cancer treatment, G08. If it is non-cancer treatment, G09. Simple. Okay. Next we have coding rule related to this follow-up. So first you need to code Z08 or G09. Okay. Then we need to add a history code. Okay. So think like that it is surveillance visit. Okay. So for example, patient had the breast cancer and patient has performed the mastectomy few years back or few days back. Okay. Now patient came in for follow-up. So which code you will use, guys? Z08 or G09? So please mention in the comment section of this video. Okay. So at last we will discuss the answer, whether we need to use G08 or G09. But if you know the answer, please mention in the comment section. Okay. Just remember one line rule. So current care is happening. You need to code it as aftercare. Only patient came in for checking. You need to code follow-up using G08 and G09. Okay. So let us see a few example scenarios related to aftercare and follow-up. Okay. So wound dressing after surgery. What is that? Aftercare. As we have discussed previously, wound dressing after surgery is aftercare. Okay. For example, patient has finished a cancer treatment. Now he came in for surveillance visit. So we need to code G08 as well as history of cancer. If it is breast cancer, you need to code G08 plus G853. Okay. So next scenario. Infection treated, patient returns just to confirm recovery, whether treatment is completed or not. Okay. So that time you need to use G09. So why G09? So as based on our guidelines, other than cancer, we need to use G09. Here, patient had undergone treatment for infection, correct? So we need to code other than cancer treatment. Okay. Next, what are the common coding mistakes most of the coders will do? Okay. First one is using G08, G09 when treatment is still ongoing. Means patient is taking or patient is undergoing ongoing treatment or current treatment. So that time we can't code G08 or G09. We need to code aftercare codes. So coding the original condition during aftercare. Okay. So based on guidelines for aftercare, we need to code the complication. We will not code the original condition. So most of the time coders will forget to code or add history code along with the follow-up visits. That is also one mistake I will see during audits. Okay. So aftercare versus follow-up. So aftercare treatment still ongoing, not fully healed, recovery and rehab, ongoing care. So mostly wound care as well as physical therapy. Okay. So what is follow-up? Just checking purpose patient came in. So cancer follow-up and routine checkup. So here we need to use G08 as well as G09 plus history code. Okay. So what is quick coding rule here? Care is equal to aftercare. Check is equal to follow-up. Okay. So as we discussed, these are the example. Dressing change post surgery, aftercare. Follow-up after cancer treatment, G08 plus history of cancer. Visit after infection resolved, Z09. Okay. So like this, we need to understand aftercare and follow-up codes. If you are having still doubts, please mention in the comment section. And previous answer for our question is G08. As patient is having the breast cancer, now patient came in for follow-up. So now we need to use G08 plus G853. So thanks for visiting our channel. If anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for same day surgery, IPDRG, HCC, CCS certification training, please send WhatsApp message to 707-526-3939. And also if you like this session, please click on like button. And also if your friends are planning to learn ICD-10 CM, please share our YouTube channel Fast Coder 21.